Good morning, welcome to this week's vlog. It is February 22nd. It is around 7 in the morning. I'm walking my mom's dog. I'm taking care of our family dog for the week. Since I'm going to school this morning, I have to take her on a walk before I go to school. This is going to be good practice for me because in June I'm going to be getting a puppy of my own and I'm gonna have to start walking it before I go to school every morning. This entire week I have emergency rotation every single day this week, but it is only in the mornings, and then in the afternoons I have lecture. So, the really good thing about having a rotation this week is that rotation doesn't start until 8:30, so I don't have to rush to get to school this morning. I'm basically gonna walk her and then gonna have breakfast. I'm gonna drink my coffee on my walk and then get to rotation. After emergency rotation, I'm gonna come back home for lunch, and then I have emergency lecture at 2. Sometime during this week, I'm gonna have to take 3 exams. They're open books, so they shouldn't be difficult. So I got to school for emergency rotation, but of course there weren't enough patients because sometimes patients don't show up. So they said I could go home. It's not even 10 a.m., but whatever, I'm going home. I'm gonna take my dog out again and eat lunch, and then I think I might come back just for an hour in the afternoon because my partner Simon is seeing one of my patients for a crown, and it'd be nice if I was just there for the first hour because we're gonna take like an impression and we have to talk about some stuff. So I'm gonna do that, and then at 2 p.m. I have Zoom lecture for emergency rotation. I'll probably log on to that on my phone like while I drive and just listen to it on my AirPods and then go back home. Hey guys, I'm home. It is almost 2 p.m. I'm working on my learning need. I decided that I wasn't going to go back to school. I actually ended up taking a nap. I was so tired. I couldn't sleep because this little one, this doggo over here, was keeping me up and I just couldn't sleep. Anyways, so I took a nap and then I decided I'm not going back to clinic because it's pointless to just go for an hour. I'm working on my learning need. I still have PBL as a third year, but it's every other week and it's really not that big of a deal. My learning need topic is Canberra in geriatrics. I usually do my learning need on 2 separate days. The first day involves me just writing my patient analysis, writing down the idea validation, putting up all my content and references, and then I usually get tired by the end of that. And that probably takes like an hour or so. And then the next day I'll revisit it and I'll read all of my content and edit some content out, highlight, write up my summary, and then I'll be done. So I'm doing the first part of the learning need process today. And then in about 20 minutes, I have the emergency rotation Zoom lecture. It is about 4 p.m. right now. I'm working on making a list of all of my patients because on Thursday I have office hours with my group practice director, and we have to indicate on a patient pool list all of our patients and all of the treatment that they need, and when their last medical history was taken, when their treatment plan was updated, when patient assessment was done, all these things. I'm also talking with my dyad partner. I have like the best dyad partner. I feel very lucky that I am paired up with him because we work well together, I think. And we're actually collaborating on a couple cases. Like for one of my patients, I did a root canal on a tooth and he's doing the crown for it. And then I was supposed to do some implants on this patient, but they no longer want implants, so instead we're gonna do a removable partial denture. So Simon and I will be working on that together. So we're like collaborating on when we can schedule this patient and how we should go about it, if we should change the crown design type, or if we should use that crown, that tooth that we're doing a crown on as an abutment tooth, but maybe we shouldn't. It's because it's been root canal treated, so it's cool discussing these things with someone. There is a meeting, an anesthesia meeting at 6 p.m. I believe there's also a different club meeting at 6 p.m. So I'm gonna choose which one to attend because I can't attend both of them on Zoom. I guess I can, one on my phone, one on my computer. but I'm not gonna do that. And then at 7 p.m., I have another Zoom meeting. It's for the Athena mentoring group. So this is like a group of ladies, and this group is led by the oral surgery person, which is Dr. Natalie Tung. She's awesome. We're going to be talking about a book that was recommended to us by her that most of us read. The book is called Rich Dad, Poor Dad. That's gonna be exciting. I've been super into finances lately. I've been super into watching the stock market go up and down lately. I've also been really into watching Bitcoin go up and down lately. Have been into all these money-making things lately. I'm excited to talk about this book because it's about money. All right, good morning. It is Tuesday. I'm out here walking my dog, just drinking my coffee on a morning walk, trying to get some vitamin D and get a little bit of exercise in. Today is not the best day. So I have good days and I have bad days. Every good day is when I just wake up and I am not in pain. Today was not a good day, unfortunately. I woke up and both of my hands are a little bit inflamed and have a little bit of pain. You can't like see the inflammation on my hands, but they just hurt a little. So since today is not considered a good day for me, I'm just going to be doing a lot of resting and doing a whole lot of nothing. I'm still gonna try to make it a good day. Like I'm still gonna try to be happy and enjoy the sun and enjoy my day and maybe do some studying, might watch some TV. I have a group practice meeting at 12 p.m. on Zoom, and that's all I have for today. So I have a free day today. But I'm in downtown Culver City. It's really cute here. There's like some stairs here. There's a core power yoga up there, and I was really excited for it to open up again because I miss doing yoga with other people. But then there was also another dog, not this dog. There was another dog that was here that I recognized, that I've walked before, and that was fun because I got to say hello to that little puppy, and that puppy is the most adorable thing ever. We're gonna continue our morning walk. I just wanted to let you know that today wasn't a good day and I might not be vlogging because it kind of hurts to hold my phone. Hi guys, it is Wednesday. Oh my goodness, look at these N95 marks. Just ignore that. It is Wednesday. It is almost 12 p.m. I just got done with my day in clinic. So today I had emergency rotation. This is the emergency clinic. I actually had a patient this time and it was kind of interesting. So I didn't do any actual work. All I did was a referral and I diagnosed a tooth. So I'm gonna tell you about it because I thought it was pretty interesting. So the patient came in, had pain on this side. It was number 3. When I looked at number 3, which is the first molar, it had a crack. Like both of the cusps were just like separated. At that point I was thinking extraction. Of course we took radiographs, we took a bite wing and a PA. There was no periapical radiolucency. I probed around the tooth. There was one pocket that fell to a 6, the rest of them were 4s. So that also tells me that it might be a vertical root fracture because of the higher probing depth in one area. Another thing that I want to mention that leads me to believe that it was vertical root fracture is that the tooth was RCT treated. So number 3 had a root canal done. When teeth get root canals, they are more brittle and they are more prone to vertical root fractures. So vertical root fractures usually occur on teeth that have been treated with RCT. There was also a sinus tract in between tooth 3 and tooth 2. There was a sinus tract. So this means that there's some sort of infection. I first thought it was coming from tooth 3, but then we traced the sinus tract with gutta percha. So we put this material called gutta percha into this pimple-like thing called a sinus tract. That's where the bacteria is draining out of. And we just put it in, poked it all the way through, and then we took another radiograph. And in the radiograph, it showed that the sinus tract was actually pointing towards number 2, which is the tooth behind number 3. So that was interesting. So we decided to do endo testing on number 2, but at this point, the patient was already anesthetized a little bit. We anesthetized a little bit to do the probings because it was hurting them. Also, patient had pain to palpation, pain to bite, and pain to percussion. But we didn't endo ice number 3 because if you looked at it clinically, both of the cusps were moving. Either way, it was unrestorable. So number 2, which is a tooth behind it, still has to be re-evaluated after number 3 gets extracted. So that's what I did this morning. I made a referral to oral surgery, and then I went to the oral surgery department to hopefully see the tooth be extracted, but it was getting kind of late, so they're just gonna extract it in the afternoon. But that was kind of an interesting experience, better than my Monday experience because I didn't do anything on Monday. Now I'm gonna go home, eat lunch, and then at 2 p.m. I have emergency rotation Zoom lecture. It kind of sucks because normally, pre-COVID times, you would have emergency rotation in the clinic full time, but we only have half days, and the second half of the day is spent on the computer, which kind of sucks because this is supposed to be our clinical experience, but whatever, I'm trying to make the most out of it. Hi guys, it is Thursday. I do not look the best, and I am not doing my best. If you ask me how I'm doing at school, I would say I'm good. How are you? It's so tiring to say that because I'm really just lying. I'm really not doing good. But you know, when someone asks you in the hallway, you kind of just have to say that because there's not enough time to tell them exactly how you're doing.
Or you see someone that you know and they ask you how you are, and you just have to say that you're fine when you're not really fine, but you just can't get into it because they would never understand.
I know they're just being nice. I know when people ask that, they're just being nice. And I've even gotten to the habit of asking other people, how are you today? And they say, good, how are you? So it's just a nice thing to do. To tell you guys the truth, I am not doing good. I have not been sleeping good because I have been waking up from random pains. Yeah, life just has not been the best for me. If I can just wake up not in pain, that's a good day for me. But most of my days have not been like that, unfortunately. Today was one of those days again. Probably every single day this week, actually. So it's hard to make videos when I know I'm not doing good inside because I want to give you guys good, happy content. I want you guys to watch my videos and like feel good inside. But if I'm being all depressed over here, it's not going to make you guys feel good. So I'm sorry about that, but I literally can't change the way I'm feeling. I'm really trying to though. Let me tell you about school today because that was like probably the best thing that happened to me today. So I went to school. I'm doing emergency rotation this week. So my shoulder's hurting and my hands like are a little bit like stiff, but I can still move them and I can still use them. And in emergency rotation, all we're doing are referrals because there's only one room where we can do aerosol procedures, and most of the time we refer to either oral surgery or to the endo department. So I knew I wasn't going to be doing much if I had a patient. So I had a patient today, very anxious patient. It was a lot of talking about past dental trauma, dental history. I was trying to get to the root of why the patient was scared of coming to the dentist. We took a pano because the patient had multiple teeth that were hurting. It wasn't just one tooth. And most of the time when a patient comes to the emergency clinic, we just treat one tooth. We just treat the area that is most in pain. But this patient, it was a full mouth case. So I signed her up to become a patient of the school. So she'll be my patient now on the second floor. And we're gonna do comprehensive care on this patient. On the pano, there was many root pieces without the crown, a lot of carious lesions. There's some periapical radiolucencies that I could see from the pano, but we're still gonna have to take more detailed radiographs. In about 2 weeks, when everything is signed up with the school, I'll be giving the patient a call and we'll be doing comprehensive care. A lot of extractions are gonna be needed. Patient is interested in implants, but we'll see if I can do that on the second floor. But most likely it will get referred to grad pros because there will be a lot of implants. But that's what I did today. It's almost noon. I'm headed home. Today I don't have any Zoom lecture for emergency rotation, so I have the afternoon off. I do have a GPD meeting, so a Zoom meeting with my group practice director to just talk about my progress in clinic. I picked up this delicious looking salad from Mendocino Farms, and I'm just out here with my dog again, and we're gonna have lunch together. You guys, I've just been in bed all day. It's 5 p.m. I just got myself up because I need to take 3 emergency rotation exams on ExamSoft. They're open book. They shouldn't be difficult. I told myself I would do this on Tuesday. I couldn't do it. Told myself I would do this yesterday. Still couldn't do it. It's Thursday now and I really just want to get it over with. It's not even part of my grade, I heard. I heard we just have to take it and it doesn't count for a grade or anything. It's just for learning purposes. My hand is hurting though, which sucks because tomorrow is the last day of emergency rotation. And most likely, I don't know if I'll be able to use it. If I'm just doing a referral, I can, use it. But if I'm assisting someone, it's going to be hard for me to type. We'll see how it goes. I also talked to my doctor and she's told me to up my dosage of my medication because the dosage that I'm at is obviously not working. Hey guys, it is Friday. It's the last day of the week. Today was my last day of emergency rotation. It went well. In the morning, my hand was hurting, so I didn't think it was going to be a good day because I didn't think I would see a patient because, I couldn't really use my hand. But I was really honest. I asked if there wasn't going to be enough patients. I asked if I could go home and I explained why, because my hand is hurting and I've been having this problem that hasn't been resolved. And then my assistant, actually, she's an ASPED student and she's like, I don't really want to see a patient. And then I told her, okay, well, I can see a patient, but I'm having this problem. And she's like, oh, no problem. I'll help you the whole time. And I knew it was just going to be a referral, so I could totally just talk with the patient and do the referral. So that was really helpful because I got to work with her and she was so helpful and I got to see a patient. So the patient that I saw today, we did 2 referrals. We did an OS referral because there was one tooth that was unrestorable and needs to be extracted because there's a huge carious lesion. There's furcation involvement. There's no way we can save it. And it has also been endo treated before, so it's previously been treated. And then the tooth behind it, that one I referred to grad endo to get a root canal because when I did all the testing, so I did palpation test, bite test, percussion test, all of those were positive except for the palpation test. There wasn't really much pain to palpation. There was no sinus tract present. For the endo ice test, it lingered and there was a lot of pain, so I diagnosed the tooth with symptomatic irreversible pulpitis and symptomatic apical periodontitis via all those testings. So I did those 2 referrals and then I also signed up the patient to become a patient of the school, so then I can finish up the crown afterwards on the tooth that's going to get endo treated, which is exciting because I haven't done any crown, so hopefully I can do that after it gets the root canal done. So overall, today was a successful day, even though my hand is pretty swollen. You can't tell that it's swollen, it just feels swollen and it's painful. But I'm getting through this. Now I'm gonna go get my weekly COVID test. I just got done taking that COVID test. That COVID test is so gross. They give you this tube to spit into with a tiny little funnel and they make you chew on a straw and everyone's just sitting 6 feet apart, just chewing on their straw, spitting into this little vial. Anyways, it's something we have to do. It's for everyone's safety. Even though we've all been vaccinated, it's still essential. So I got that done today. And I actually had trouble getting into school today because the last time I took my COVID test was Thursday. So technically it's been more than a week and they didn't let me get into school. But then eventually they let me because I told them I had a test scheduled for today, which I did. Usually I don't come to school on Fridays, so that was the first time I had this little mix up. I'm done with this week. I hope you guys had a better week than I did. Overall, this week was fine. I had a good experience with emergency rotation. I'm glad it wasn't all through Zoom. Although today I do have emergency rotation on Zoom at 2 p.m. So I'm going to log on to that. I also made a hair appointment at 1 p.m. So if I'm not done with that, I'm just gonna log on to Zoom and put my AirPods on while I'm at my hair appointment. Yeah, I'm just gonna get a haircut and probably get a toner done. I don't know. I don't usually do much to my hair, but this week I haven't been feeling well. Last week I also wasn't feeling well and I wanted to do something to treat myself. Thank you guys so much for watching this vlog. I hope you guys liked it. If you did, please give it a thumbs up. If you're not already subscribed to my channel, don't forget to subscribe. See you guys in the next video. Bye.